Hey everyone, it's Hina here at Rebalance Physical Therapy and Wellness in Philadelphia, Pennsylvania, as well as on the main line in Narberth, Pennsylvania. And I want to talk to any of our men out there who are having issues with ejaculatory pain. And for many men, it could have come from many different ways, okay? So I kind of want to address why this might be happening, what made it kind of come around, and then basically what you can do about it. And so basically with ejaculatory type pain, whether it's with excessive sexual activity, whether it's having intercourse, whether it's self-pleasure, masturbation, or, any other method that you may have ejaculation that happens. Many men out there are actually complaining that they're having either a burning sensation, a throbbing sensation, or a change in how they're ejaculating. Maybe it's not the way that it normally is. Maybe the fluid that comes out is actually dribbling versus being, more forceful and the way that it should be. And so, why is this basically happening? And the symptoms that you're having of pain, especially if you've gone, and I'm sure many of you have already seen a urologist or you've seen your physician and they all have said, nah, we're not really sure what's going on. Perhaps some of you, again, you've heard, some of you have already watched my other videos, but maybe you've been given antibiotics or something like that because they think that the pain that you are having is coming from an infection. Or if they haven't found an infection, they think that there could be something underlying, so let's just try this anyway. And so basically, if you've done all that and it hasn't really worked, they're not really finding an active infection going on, then chances are what you have going on is a muscle problem. And how do I know this? Well, I'm a physical therapist. I've been actually working with something called pelvic floor dysfunction, which I'm going to explain to you in a bit. I've been working with it for 20 plus years. And our practice here in Philadelphia actually sees a ton of men that are suffering from this type of symptom. And sometimes this ejaculatory pain can also be accompanied by bladder changes. Some of you may be experiencing bladder frequency, urgency, urinary hesitation, meaning like it takes a while for your urine to come out. And then you may have had a ton of other symptoms that are accompanied with this. And I'm not going to go into all of those right now because I'm going to tell you a little bit more about how to find out more about this a little bit later. But specifically for this type of pain, it might be coming from a group of muscles called your pelvic floor. Now, these muscles, I'm going to show you here, are located deep inside your pelvis. So if we take a look at another model, okay, right here, this right here is your spine. And this is your pelvis. Often, many people mistaken this as your hip, but it's actually your pelvis, all right? And then this is your hip bone right in through here, okay? You can see that round kind of knot, but everything up above it is the pelvis. And then inside the pelvis, you've got a group of muscles, okay? If you look inside right here, these red muscles right here is called your pelvic floor. And you can't see them from the outside, and it's sometimes difficult to touch many of these muscles from the outside. Now your bladder, which is right here, sits right inside of this pelvic floor area. So these muscles actually give you function, okay, down below you can see from here. Now this is a female model because the male model is actually difficult to come by, but just pretend there's a penis here, otherwise everything else is the same. But these muscles right here govern function of urination and defecation as well as sexual pleasure, okay? So anytime you have a problem in these muscles, and I'm going to tell you what the problem is, but anytime you have a problem in those muscles, they can actually change the way your bladder functions. They can change the way your sexual functioning is going, as well as how you have a bowel movement. So now typically what happens is these muscles can become tight. And I know it sounds weird because many of you may have heard of these pelvic floor muscles, but you've often been heard of contracting these muscles and tightening them. And the way you can kind of identify these muscles is if you're trying to hold back your urine, you might feel some sort of contraction happening in between your perineum, these are these muscles. And you can do it right now as I'm talking to you, and you can feel like, I feel something happening down there. Those are these muscles right over here. And when they become tight, and they can become tight for a lot of different reasons, when they become tight, they can actually give you referred pain. And oftentimes with ejaculation, these muscles actually become more involved, and they can become tighter and kind of basically reproduce this burning, throbbing pain sensation after ejaculation. And oftentimes, at least my own clients have sometimes said, it feels like I have the flu in my pelvis. And so that's basically why why this might be happening, and why you're not getting necessarily straightforward answers from any of the physicians and healthcare practitioners that you've seen. And oftentimes there is a long history behind this too. You may feel like this all of a sudden came on, but oftentimes it's actually been building up over time. And so, I hope that for some of you who have been looking for the answer to this, you kind of have, been able to see why this actually is happening. Now, oftentimes these muscles don't necessarily just become tight on their own. Usually it's a bunch of other muscles that are also located on the outside of the body that also kind of compile with this pelvic floor to become problematic. So oftentimes what I hear is people will also say, well, I have low back pain issues, I've got hip issues, I've got other issues that are going on. And you can see in this diagram here, now not all the muscles are here, but you can see that these pelvic floor muscles attach to this pelvis, okay? Again, this is the pelvis right here. They attach to these pelvis, but there's a lot of other muscles that actually attach onto this pelvis. So you've got, gluteal muscles here, you've got low back muscles here, you've got muscles that go into your thighs. And then if I was able to flip this picture around, you would actually see that you've got muscles in through your abdominals, in through the sides, as well as a bunch of other musculature that could be adding to this problem. So how do you basically treat this? Now, oftentimes, some of you guys have seen some of my other videos. Basically, pelvic floor physical therapy helps with this. And what we have done is we've actually, because I'm a pelvic floor therapist, I've actually found that so many of you guys who have been following me, who have subscribed to our website, and I would say if you haven't subscribe to with the button down below. But some of you have said, I really just want to find help that I can start doing on my own. And so what we heard from all of you is that you really wanted us to create a program. So we actually did. We finally created a program where you guys can actually treat a lot of these muscles that are tight, as well as a lot of other surrounding musculature. We kind of take you through a self-guided evaluation on how to work and release these tight muscles. And usually when you start working on this kind of holistic approach of treating everything in terms of all the muscles that are tight on the outside that are influencing why these pelvic floor muscles are tight, and then also if you're able to directly learn how to work on these muscles, and then learn the relevant stretches and also the coordination exercises that you need to do to really get these muscles to calm down, that for many people have actually helped the pain that they're having. And so down below in the information box, we actually have a link to our program. Now, the other cool thing about this link for some of you, even if you decide this is not something that I want to do, I encourage all of you who are having this type of symptom to actually watch the PowerPoint presentation that I actually have put together in this video, because it really does explain in depth how these muscles kind of can become problematic, what in your history, what in your past, or possibly what things in your present lead up to these problems, and how a lot of these other musculatures in detail can actually become a problem. And then basically how to then learn a program to actually release this musculature and what you need to do. And I think that is so important, because for so many people, there is not really good information, and they haven't been able to really find good help out there to really explain how I do in this PowerPoint presentation how all of this basically makes sense. And many of you I know are probably going around thinking, you know, am I crazy? And then some of you, it's probably really messing with your head too, because it produces anxiety because you don't really know what's going on, why it's going on, and no one's really been able to really explain it to you in a very helpful way. So I really encourage you guys, if some of you already know me, you've heard some of my videos, and you're still looking to find out how you can get help, click the link below and you'll see, right, if you scroll down to the bottom, you'll see that there's a link to actually buy into the program, and it's relatively inexpensive considering how much many of you have probably already spent trying to figure out how to, you know, solve this issue. And for some of you who are watching this video for the very first time, I would highly, highly, highly encourage you to watch that PowerPoint presentation. It's a 30-minute presentation, and it really goes through basically a little bit more of the nitty-gritty on what's going on so that you can really identify and learn what's going on and what can help. So I hope this was helpful to you. And then, like I said, all of our information is down below, and we hope to hear from you soon. Talk to you soon.